Namaskar viewers, hello and welcome to Sansad TV. I am Tina Jha, you're watching Perspective. As India marches towards the goal of Viksit Bharat by 2047, Prime Minister Narendra Modi has placed the country's youth at the centre of that vision. Launching the Nasha Mukt Yuva for Viksit Bharat Sankalp Abhiyan, he said a developed India can only be built by a generation that is healthy, confident and free from substance abuse. In one of the country's largest anti-drug public participation initiatives, more than 1 crore young people connected from over 28,000 locations across the country took a pledge for a drug-free India. Supported by spiritual organizations, educational institutions, also industry bodies and civil society groups, the campaign seeks to transform the fight against substance abuse into a sustained Jan Bhagidari movement.
जब देश ने विकसित भारत का लक्ष्य तय किया है तो इसके लिए आवश्यक है देश का युवा तन से स्वस्थ हो, मन से स्वस्थ हो, आत्मविश्वास से भरपूर हो और ड्रग्स जैसी घातक आदत से हमेशा हमेशा दूर ही रहे, दूर हो.
To discuss this and more, we are joined by two distinguished guests. I'm delighted to welcome Dr. Rajesh Kumar. He is Executive Director, Society for Promotion of Youth and Masses. Dr. Kumar, thank you for taking out time and joining us on the program. Dr. Kumar, let me begin, with your thoughts first. You heard the Prime Minister. The Prime Minister, in fact, has called for a 100-week Jan Bhagidari movement against substance abuse. From your experience, you've worked with young people. How significant is this long-term community-led approach that the government has started now?
I would like to really thank Honorable Prime Minister for taking this great initiative. And in fact, we have been working in this sector for last almost 40 years. We have not seen as big as this in last 40 years. And the best part, I think it must be one of the largest in the world, because India being a country of 140 crore. So this is something we have been waiting, that if the Prime Minister and at the level of the Prime Minister, if this is being addressed, this was the best possible as program what we could see. And in fact, the Prime Minister initially he launched this around 5 years back, Nasha Mukt Bharat. So this is a continuation of that, and I think that was launched on 13th or 14th of August. So this is the best we could get, and the best part, he has communicated in a very big way, and around more than 1 crore people yesterday took pledge. There was a great movement all over the country, and as per your information, around 30,000 places people took, they listened Prime Minister. They also participated in various activities, and our organization SPYM, we also we were part of this whole initiative. In fact, please understand there are two sides of drug. One is called demand and other is called supply. So for supply reduction, a lot of good initiatives have been taken, and in last 5 years under the Honorable Home Minister's leadership, Amit Shah ji, some positive movements we could see easily, and the best part is that people are now aware that it is not easy to get drug from the nook and corner. So that was a great initiative by the supply reduction program. We were lacking something in the demand reduction, and demand, when the demand is there, the supplier will find some way. So this is a great initiative for the reducing demand. And another very important aspect is that around, as per the Government of India data of 2018-2019, 99% young population do not use drug. So this will further strengthen the prevention initiative, awareness initiative, and we all are grateful to Honorable Prime Minister for taking this agenda as very, very important part of the country's resolve.
Absolutely. I think when it comes to our fight against drugs, prevention is always the more effective way than rehabilitation. And with movements like these, when we try and bring in the youth themselves to take charge of movements like these, lead the Jan Bhagidari movement that the government has initiated. The role of families in winning this war against drugs is the most important. Families provide the first support system to any child. How can parents build that kind of trust with their child so that the children can discuss any form of stress, of any kind of problem, even if it's related to drug abuse, without having that fear of being pushed away or being subject to punishment?
See, unfortunately, stigma is a big barrier. Usually what happens that mother is the first person who understands and knows that something is wrong with my child, and then she tries to manage at her own level without informing her husband or other family members. Number one, stigma has to be addressed as a country as a whole. If you recall COVID time, when the stigma related to COVID was so high, the people were not comfortable disclosing that I'm affected by COVID virus. Same is happening here. See, SPYM runs 3 treatment centers, and large number of children said that we never knew that taking few times will make us dependent. And again, Dr. Desai, what he said, that drug use and crime, it is like two sides of same coin, because 2,000 to 3,000 rupees a day, if someone is dependent on smack or opiates, from where this person will get, this child will get. So drug, crime, and family is not aware. In fact, what Government of India has done, Ministry of Social Justice, they have launched a beautiful program called Nav Chetna. Now in Nav Chetna, the one chapter is exclusively for parents. That parents are oriented. They are told that what are the signs and symptoms for drug use if your child has just started it. Then what are the services you can get within the school, outside school, or in the government hospital setup. Then another big challenge is, even if the family is ready to help his or her child for the services, those services are not available. There are only very few centers are available all over the country where the children and girls get admitted or get any medical help. So what happens? They take their children or their young adult to treatment centers. Those are torture centers, and once a person goes to these torture centers, then they are reluctant to going to any other medical service. So these are the few things, and it all starts because of the stigma. So once we address the stigma, we empower family, we educate family, and please understand, most of the children, like I'm sure 99% plus children are in school, and the school should be the place. School-based teacher-led program this Nav Chetna is, and that has to be integrated on a regular basis. And Government of India is going to train around 1 million master trainers. So this one way we are going to help and reduce the demand. See, already, right. Please understand, it's a big population. Young population is big. I think below 25 years is the 50% India's population. So we have to invest in prevention. There is no other route.
Absolutely. I mean, with the kind of interventions and the kind of enthusiasm with which this national movement has started, I think the pressure is on every stakeholder to give momentum to this kind of movement and take it to its logical end. How do we continue to mobilize that kind of support and ensure that we are able to sustain and add greater momentum to this movement?
See, this program is for 100 weeks. 100 weeks means almost 2 years. So somewhere government has committed that we will continue for next 2 years. So that is one positive aspect. Number two, it is not just one ministry or one department is going to work. It is the entire, and Honorable Prime Minister has really laid down the whole roadmap. Number three, please understand there are 4 stages. One is simple awareness. Awareness is only creating enabling environment, and we are all right now talking because Honorable Prime Minister has said something that this has to be done. So that is the second stage. That stage is called prevention. Now in prevention, there are three minimum aspects. One is of course awareness. Number 2 is skill building. So we have to help, and that is all life skill based. And the third is provision of services. So that's second stage. The third stage is the stage where we create services. Now those services for gender means for female, there are very few centers in the country, and unfortunately the addiction among women is rising. And if you look at the center this 2018-2019 data, where the large number of women are also dependent on drug. So again, developing the whole services. It is not necessary that the one person has to be admitted in the treatment center for long. No, it could be OPD, it could be only counseling based, but quality. Now, from where the quality will come for all these 3 sectors, that will come only when you develop, or the country develops manpower. Manpower has to be developed based on science and evidence training modules. And for example, generally people will say, what is the role of corporates or big industries? They are employing large number of workforce. So it is the responsibility of the corporate and industry or PWD departments or national highway that around highways, if they can organize 1 hour or 2 hours program in 6 months or 1 year, something on alcohol. So every partner needs to be involved, and they have to be capacitated, they have to be trained. Then only we can sustain the movement. Otherwise, this will be among only those who are already converted, we are converting them.
So let's make the next 100 weeks count. On that note, we'll call it a wrap on this edition of Perspective. Thank you once again, Dr. Desai and Dr. Kumar, for joining us and sharing your valuable insights with us and our viewers. And to you viewers, thank you very much for your time as well.